Good morning, everyone. I'm Carolina from Making Life, and today I'm here to interview Paola Minghetti, full professor at the Department of Pharmaceutical Science of University of Milan. Please, if you want to introduce yourself and your partnership with AFI.
Thank you, Carolina. Good morning to everyone. I'm Paola Minghetti. I'm full professor in the School of Pharmacy of the University of Milan. And since many years, I am a member of the AFI, that is an association of people working mainly in industry, pharmaceutical industry, but also industry of medical device, industry of health product. But there are some of us that are working in university that have academic rules that are involved in this association. I think that is important because it is a place where we can meet and we can discuss the innovation, the new rules, and everything that is ongoing on the pharmaceutical field and pharmaceutical industry, and having a different opinion from different point of view, like people working in industry, people working in the university, is useful for everyone. Since many years, I am vice president of this association, and I am really very happy to collaborate to the work of AFI.
So I really agree with you with the importance of the partnership and of the collaboration between the academic and the industry part of the pharmaceutical environment and sector. So at the end of the month of April, so nearly a month ago, the European Commission brought out the proposal of the new pharmaceutical legislation, the most significant reform in 2 decades and strongly needed. Now that some weeks has passed, could you comment on the new legislation, outline the main points of the proposal and any critical issues if you find some?
Yes, I agree with you. It's a very important step in the directive and regulation of medicinal product in Europe. Since we have the first directive, it was in the 1965, and it was amended sometime, and now we have the directive 2001-23, but are really many years that the change of the directive are only small amendments. In this sense, the European Parliament decided to go through an important modification of the directive, even if they decide to go on with the directive instead of trying to go further and to have a regulation. In fact, we have a proposal for a directive and a proposal of modification of the two regulations that we have, that is one from orphan drug and one for pediatrics. It is an important moment because we have, as all of you know probably, problem of affordable drugs, equity of drugs in all Europe. We have some problem of difficulty in production of all the drug that we need. And so sometimes we have patients that need the drug and the drug is not available in a country or all around the country. So we have some shortage that was very happened in very few cases in the past, but now following COVID, following the war, following a different situation, is becoming a very important point. So what did the Commission try to do with this modification? Are to reduce the risk of shortage and trying to find an agreement with the industry, especially for the more important drugs that are not for very important disease. The other problem is affordable. That means the price of the drug, the possibility of have the drug in the National Health Service in all the country. This situation is very different country by country because it's still at the national level. But of course, the problem of patent, the problem of data protection, of market exclusivity are at the European level. So what they try to do is to change the rules of this aspect, not the patent, because the patent is general rule, not only for pharmaceutical, so you cannot modify, but what they want is to modify the rules of market exclusivity and data protection. And this is a very important and huge point, because of course there is not at the moment an agreement between industries and parliament and public administration. So I think we have still to discuss to find the best solution for the citizen, European citizen.
I think that the AFI Symposium and your session could be a very important occasion to talk about it, because there will be some experts, and I think that at that time in June the proposal will not be at the end of the questioning. So probably there is some margins to talk and to bring evaluation from experts from Italy, in this case, to the European Commission.
Yes, exactly. This is the idea. The idea is to discuss the proposal, to have some expert that will discuss some part of the directive and the regulation, and then we have a roundtable with the different stakeholders. We have people coming from the Italian agency, people coming from industry of active ingredient, industry of final product, and people coming from the university. And the idea is to discuss together the main point, the main criticism of the new proposal, and then to have a document that can be sent to the Europe to ask some modification of that document.
Yes, I think this is the most important point of all the symposium. Thank you very much, Professor Minghetti, for your time. You were very clear, and I hope to see you at the AFI Symposium in June.
Thank you to you, and I hope to see a lot of people involved in pharmaceutical field at Rimini in June. Thank you.
Yes, thank you. Goodbye.